Today we are going to discuss the CSU San Bernardino 2023-2024 Student Health Insurance Plan. Your insurance team consists of two separate entities that work in tandem. The first is Academic Health Plans. And Academic Health Plans is your plan administrator. And we provide the following services to you as students. We handle the website or microsite for your school, the plan materials, enrollment, billing, customer care for enrollment, and any on-campus support related to the student health insurance plan. You can reach Academic Health Plans toll-free at 800-537-1777. You can also reach us directly through the CSU San Bernardino microsite, which can be found at csusb.mycare26.com, or via email at educlientservices@ahpcare.com. The next entity is Wellaway, and Wellaway is your insurance carrier. And Wellaway will provide the following services to you. They will handle the claims administration, any claims customer service questions, the distribution of ID cards, as well as access to a large network of providers. You can reach them directly at 855-773-7810 via concierge care, or their website is wellaway.com. Now we will touch on just a couple of health insurance basics. So why is health insurance important? Well, in the United States, medical care can be extremely expensive. And unfortunately, without insurance, medical bills can be costly and could potentially affect your credit if left unpaid. Because of the importance of health insurance, all international students at San Bernardino are required to carry the insurance. And you will enroll yourself at your designated microsite at csusb.mycare26.edu during the designated open enrollment periods. Your insurance ID card. Once you receive your welcome email from Wellaway, you can download your insurance ID card. You will visit wellaway.com to set up an account. If you need to seek medical treatment before you receive notice that your ID card is active, please contact Academic Health Plans Risk Strategies at 800-537-1777 to obtain your insurance ID number. And most importantly, always carry your ID card with you, be it a printout or a copy on your phone. You will need your ID card when you visit the student health center, a doctor's office, an urgent care, or even a hospital and/or emergency room. Where should you seek care? First up is the Student Health Center. You would visit the Student Health Center for any minor issues. And if possible, you would want to visit the Student Health Center first before seeking care elsewhere. Next would be a primary care physician or a specialist, depending on what you need to be seen for. You can see a primary care physician or a specialist for preventive care, behavioral health conditions, or even more pressing medical conditions than a minor issue. An urgent care center. An urgent care center is for same-day services that can handle a variety of medical problems that need to be treated right away, but are not considered life or limb threatening. And lastly would be the emergency room. You would only go to the emergency room for medical conditions that are considered life or limb threatening, because they may require rapid or advanced treatments that are only available in a hospital setting. Finding a PPO medical provider. PPO stands for Preferred Provider Organization, and your student health plan is a PPO health plan or Preferred Provider Organization health plan. And what that means is you can visit any doctor that you wish, but in order to keep your costs as low as possible, you should use an in-network provider whenever available. Under your plan, you will be responsible for a larger portion of the medical bills should you use an out-of-network provider. If you do require medical care outside of the student health center, you can search for a participating medical provider at wellaway.com. And your PPO network that providers must participate with in order to be considered in network is called United Healthcare Global Network. And one thing to note, when making a doctor's appointment, it is always good to confirm with the provider's office that they are part of the United Healthcare Global Network. Use your insurance. Let's go over a few of the most important points. The first is you're going to either visit the Student Health Center or a United Healthcare Global Network provider for the best benefit. You always want to present the office staff with your ID card upon each visit. This will ensure proper filing and handling of any of your claims. Once you are seen, the provider should then submit a claim to the insurance payer for reimbursement of charges. Once charges are processed, you will then receive what's called an explanation of benefits, or EOB for short. An EOB is a breakdown of what your insurance pays and what you may owe. But please note, this is not a bill. Wellaway or academic health plans will never send you a bill for services. The provider will send you a bill if there is a balance due once the insurance has processed the claim. However, in some instances, the medical provider may not file the claim on your behalf, so you will need to submit the claim yourself for reimbursement. You will then want to download and fill out a claim form completely. You want to make sure that you include your member ID number with Wellaway when filling this out. And you can find the claim form at wellaway.com. You want to make sure that you obtain all itemized bills from the provider for services received. You can then submit your claim form and all itemized bills that are related to the visit via email to conciergecare@payerfusion.com. And one thing to note is, please keep all copies of the documents that you submit. Now let's discuss your plan benefits. The deductible. The deductible is the amount that you will pay out of pocket before the insurance company will pay any benefit. And under this plan, your deductible is $250 if you are seen by an in-network United Healthcare Global PPO provider. However, if you see any out-of-network providers, your deductible then jumps to $500. You have what's called an out-of-pocket maximum. This maximum is the amount that you will be responsible for. This does not, however, include any services that are excluded under the policy. The out-of-pocket maximum, though, does include any deductible and any copay amounts that you pay. Your out-of-pocket maximum for United Healthcare Global PPO providers is individually $6,000. For a family or you and any dependents, the total is $12,000. If you see an out-of-network provider, it's $8,000 per insured person, and it is unlimited per family should you have dependents on your plan, which means that if you do see out-of-network providers that are not in the United Healthcare Global provider network, that you will never meet an out-of-pocket maximum. Then we have what's called coinsurance. So the coinsurance is the percentage that the insurance company will pay for any of the listed covered services after you meet your deductible and before your out-of-pocket max is met. The great thing about this plan, though, is if you see a United Healthcare Global PPO provider, after your deductible of $250 and any applicable copays, the plan will then pay at 100%, which means if the services are covered, the plan will then pick up the rest of the balance after your deductible and after your copay. If you go out of network, though, after your deductible and after any copays, the plan is then going to pay 80% of the balance, which means you as the patient will then have to pay 20%. And that 20% will then be in addition to any copays that may apply. And for a copayment, this is a fixed dollar amount that you will pay when services are received. So this means if you walk into the doctor's office and for a primary care visit, let's say, you're going to pay $25 when you walk in the door. And if your deductible has been met, then the plan will pay at 100%. And one thing to note, and one of the reasons why we direct you as students to the Student Health Center when possible, is that if you are seen at the Student Health Center, your copay is waived. So you will not need to pay anything at the time when you walk in the door. If you go out of network, of course, the copays are still the same as in network. It's still going to be a $25 copay to walk into a doctor's office, but then you're still going to pay that 20% coinsurance. If you go to an urgent care, it's going to be a $50 copay. If you go into the hospital, not the emergency room, if you go into the hospital, it's going to be a $250 copay per visit. A hospital emergency room is a $150 copay. It is waived if you are admitted into the hospital, but if you are admitted, then your copay is actually going to be $250 instead of the $150. You also do have access to prescription medications, and we will touch on that here in a little bit, but you do have copays with that depending on the tier that your drug falls into. Tier 1 is $10, Tier 2 is $20, Tier 3 is $40. But you will want to make sure that you see an in-network pharmacy. If not, your prescription is not covered. So that's a high-level overview of your actual benefits regarding deductible, your out-of-pocket maximum, your coinsurance, and any copayments. Specific questions or benefits, you can then refer to the plan materials, and it will have specifics on there. Or, as mentioned earlier, you can reach out to concierge care, which is part of Wellaway, and they can answer any benefit questions for you as well. So we touched on the benefits. Now let's go over a few of the coverage details. But please note this is not all inclusive. As I mentioned a second ago, any detailed benefits can be found in the plan materials. But what exactly does your plan cover? Well, the student health insurance plan is designed to help cover medical expenses that you may incur for accidents and/or sicknesses that happen while you are studying at CSU San Bernardino. You are covered worldwide, except for your home country, while you are enrolled in classes and covered under the plan. So covered expenses include, but as I mentioned, not limited to, the following: your doctor visits, be it at the student health center or a general physician's office or a specialist office. Of course, it also includes urgent care coverage or walk-in clinics, emergency room visits and hospital admissions, surgery, be it inpatient or outpatient, tests and procedures. You also have coverage for laboratory and radiology services such as MRIs, CAT scans, x-rays, things like that. You do have coverage for physical therapy. And then should you need maternity and prenatal care, that is also available to you as a student. And then again, prescription drugs are also available to you under the plan. Now let's touch on prescription medications. As I've mentioned a couple of times before, your plan does have benefits for you to obtain medication when prescribed by a physician. In order to fill the prescription, you would visit any participating pharmacy and provide them with a copy of your insurance ID card and the prescription if provided by your doctor. Most physicians' offices will submit your prescription electronically. However, if not, take in the physical prescription. When you do go to pick up your prescription, the pharmacy will then charge you any applicable copay. Your pharmacy network is EHIM via Wellaway. In order to locate an EHIM Wellaway pharmacy, you would visit wellaway.com. As mentioned under the benefit slide, you must fill your prescriptions at a network EHIM pharmacy in order for the prescription to be covered. If you do not obtain your prescription at an EHIM pharmacy, there will be no benefits. You will have to pay the full cost of the prescription. Now we are going to briefly discuss ancillary services available to you. These ancillary services or add-on services are separate from the student health insurance plan. And if and when utilizing these services, they are at no additional cost to you. So the first one is Academic Emergency Services, or AES. And this is a travel assistance service. And it is available to you if you are more than 100 miles from your home, or outside your home country. So this could be utilized while you are here in the United States, if you are traveling within the United States, or should you be traveling overseas, but not in your home country. So the first thing it would cover is emergency medical evacuation. So if you are overseas and an emergency happens to occur, they can get you out of there ASAP. If you require medically advisable repatriation, so if you are studying in the United States, they will make sure that you can get back home if your health depends on it. A visit by family or friends. This is a great add-on that Academic Emergency Services offers. If there is a medical emergency and you are hospitalized, they will make sure that the ones that care about you are there to support you. So they will cover their travel expenses to visit you while you are hospitalized. And should you need any pre-travel assistance, if you have lost luggage, prescription assistance, even translation assistance, and emergency message transmittal. Now, these services are not all inclusive. AES covers many additional services, and you will have access to all of them. This is available 24 hours a day, 7 days a week, no matter the country you are in, except for your home country. The next ancillary service or add-on service available to you is the Academic Student Assistance Program, or ASAP. And this option gives you unlimited assessments, counseling, and individual crisis intervention. It offers support for stress, depression, family and relationship concerns, and even substance abuse. They do offer verified referrals to community programs and resources in your area. They also can assist with online searches for child and elder care services, schools, pet resources, just to name a few. And it also offers some legal, financial, and identity theft consultations and resources for you as well, should you require those. And just like with the AES program, what is listed here is not all inclusive. There are other available options through the ASAP program, and it is also available to you at no additional cost when utilizing it. And the last add-on or ancillary service is Academic Life Care, or ALC. And ALC provides virtual visits 24/7 from your smartphone, computer, or laptop, or other mobile device. It covers urgent care services, psychiatry, which also includes med management, therapy, as well as nutrition services. It gives you immediate access to urgent care. It is easy to schedule behavioral health visits, and it has a $0 copay. Again, this is also at no additional cost to you when utilizing it. Now, those are 3 ancillary services or add-on services, as mentioned, that are available to you as the student. They are separate from the student health insurance plan, and you can utilize them whenever necessary. This is just a high-level overview of these services. You will be provided additional information on how to access any of those services, in particular Academic Life Care and the Academic Student Assistance Program. Your school will have dedicated codes in order to utilize those at no cost to you. Now let's do a quick recap. Visit the Student Health Center or a United Healthcare Global Options PPO provider when you can. Again, you are not required to utilize a United Healthcare Global Options PPO provider, but if you don't, you need to keep in mind that you will pay more out of pocket. Only utilize the emergency room in a true emergency. Once you receive your welcome email from Wellaway, that is then when you will create an account at wellaway.com. At that time is when you can download your ID card. And then of course, always carry your ID card with you. You always want to present your ID card every time you are seen for medical services. You will need it in order to pick up your prescriptions. And it's just a really good habit to get into, to always carry your ID card with you because you just never know when you might need it. Please utilize the ancillary services available to you through Academic Life Care, ALC, Academic Student Assistance Program, ASAP, or the Academic Emergency Services, AES, when needed. They are available to you at no additional cost, so please take advantage of them. They're awesome services to utilize. And then academic health plans, we are here to help you with any questions you may have. Please reach out to us at 800-537-1777, or you can email us at educlientservices@ahpcare.com. And then Wellaway, your carrier, is also here to assist you with any benefit or claims questions you may have. And you can reach them through concierge care at 855-773-7810 or at wellaway.com. And in closing, thank you. On behalf of myself and the Academic Health Plans team, welcome. We all wish you the very best this year at CSU San Bernardino.